Let's follow the data. And on this, the medical advice is clear that it's safe for fully vaccinated individuals to be indoors together. And frankly, this is an example. We can show people what's possible once you get fully vaccinated. So, this makes so much sense on so many fronts. And it's just wonderful to see a campaign which started yesterday. And I knew it was last minute, but it's just beautiful to see that we were able to make this happen.
We said that would be reasonable, and with Toronto Public Health, with those measures in place, it would be safe, and knowing that they are experts at handling infection prevention control and have been doing so steadfastly over the last year and a half and much more intensely in the last 4 to 5 months. So thank you for those who get the opportunity to go and for representing those who may not be able to go, but we want to thank all of you for your fantastic job that you have done and that you are going to be doing, and we really want to honor you that way. So thank you.
Brampton Mayor Patrick Brown spearheaded the push to have fully vaccinated fans watch tonight's big game in person, and Dr. David Williams supported it.
But beyond the fact that 550 people are breathing the same air under the same roof, what does it say about where we are and where we're going? Joining us on CP24 tonight to talk about that, the director of Ontario's COVID-19 Science Advisory Table, Dr. Peter Juni, and Dr. Alon Vaisman is an infectious disease physician who's joined us before. Raywat Deonandan is an epidemiologist from the University of Ottawa. Thank you all very much for making time for CP24 tonight once more. Dr. Juni, the game is on and there are fans in the seats, but also our numbers are as low as they've been, a few months ago. What does that say to you? How are you feeling today?
Well, I'm feeling actually quite good. What it shows actually that we were successful with our vaccine rollout, with emphasizing the hotspots, that we went there and really just changed the situation considerably. And what you see now, tonight is basically a pilot of what's coming. And I think if we consider this to be a pilot, that gives us a bit of a glimpse. That's a good thing.
And when you say a pilot, Dr. Juni, about what's to come, this is 550 people in a stadium that could fit more than 20,000. Should we get used to the idea that when we are able to go back, that we will be going back with significantly reduced numbers for quite a significant period of time?
At the beginning, certainly, it takes a long time until we will just be in the completely endemic phase of this story that we're in here. And especially in autumn, we will need to be very careful. We will have people who didn't want to get vaccinated. We have the variants of concern around, especially now where B1617 originally found in India. And this will be a challenge. We need to be aware of that these variants are much more transmissible than the original ones. This means in autumn, we need to tread very carefully at the beginning and take this stepwisely.
Dr. Vaisman, over the weekend, it was pitched that healthcare workers should be able to watch this Leafs game in Scotiabank Arena. And at first, the government said no, and there was a lot of reaction on social media to that. What were your thoughts when it was going back and forth into where we've reached now?
I think it's a great idea. It's a great way to show your appreciation for healthcare workers. And secondly, it's also a very safe thing to do, considering that these individuals will all be fully vaccinated. They'll be well spaced. It's a well aerated area. And also, as was mentioned, the case numbers are generally dropping as well in Ontario. So the likelihood of there being any transmission events here is low. And it's a great way for the province and for the Maple Leafs to show their appreciation for all the hardworking healthcare workers of the last year during the pandemic.
Yeah, there's no doubt about that. And of course, we include you among them, Dr. Vaisman. Raywat, let's bring you into the conversation now. Do you have any concerns at all about what's happening right now?
Actually, no. I mean, the risk isn't zero, but it's pretty close to zero, to the point where you can consider it to be zero. As noted, huge stadium, only 550 people, fully vaccinated, wearing masks, spaced out. It's pretty close to being outside. I like to think of this, though, as a taste or a pilot project, as Dr. Juni has said, for maybe vaccine passports for domestic use. This is the carrot, right? This is what we can do if you're vaccinated, and people need to see that. The stick will be if you don't get vaccinated, you can't do some of these things, and you'll have to prove that you test negative instead. So get used to this. This might be our norm for a few months.
Raywat, do you see people making the argument then after this game, no matter who wins, that there should be other things opening up? I'm thinking about the fitness industry.
Yeah, I certainly see that argument. If we can make stadiums safer, really maximally safe, we can probably make some other places safe-ish as well. Fitness industry works. Gyms, we can make them outdoors. You can open windows. We can improve ventilation. We can have proof of vaccination, which is key. That's a big part of this, proof of vaccination. Proof of a negative test would be useful. Proof of recovery from COVID would be useful as well. The Europeans have some of this in place already. We can steal some of their approaches.
Dr. Vaisman, what do you think this says to the argument about reopening schools? A lot of people are suggesting it should happen. However, most of the children that go back to school won't even have one vaccination, let alone two.
Yeah, it's hard to make comparisons between what's going to happen tonight versus what would be the situation if schools are to reopen. But I think some of the underlying rationale is similar in that the case numbers are dropping, more people are being vaccinated. And then, as was mentioned also, because it's warmer, there's more opportunity to have situations where people are more spaced out and better ventilated settings, perhaps outdoors with the schools. So although it's a very different setting, the underlying concept with the cases dropping is what kind of drives this decision to allow for fans to be at stadiums and is the impetus for the discussion about reopening schools this month.
Dr. Juni, can you speak to that as well? The science table advising the Premier on this. We're waiting maybe a day or two to find out whether schools will open just for a few weeks. When you consider the value of students going back to school for those few weeks, what would that be?
The value would be to mitigate the challenges that we have, especially with the mental health, the social situation, especially for vulnerable families. That's one of the issues here that we would like to address. It may not be as valuable academically speaking, but what the idea here is to address, in a first step, some of the issues we're seeing. We see a lot more eating disorders, for instance, and a lot more mental issues in our data, and that's probably just the tip of the iceberg. The idea here is to reconnect kids to the system and make sure that they have, in a controlled environment. We just talk about 3 weeks here, which is a controlled risk. Just have them back in school and before they go into summer break.
So 3 weeks is sort of worth it sounds like there. Let's talk, Dr. Juni, about the province's potentially new Chief Medical Officer of Health. Dr. Kieran Moore has been put forward as a name by the government, and if that passes, then he will take over from Dr. David Williams. What's your early reaction to potentially Dr. Moore becoming the new Chief Medical Officer of Health?
To be honest with you, when I heard it first, I thought that's too good to be true. So I'm very pleased about that. And he has an excellent track record. And this would be an excellent next step here.
Yeah, Dr. Vaisman, do you have thoughts on that, getting a new Chief Medical Officer of Health during this pandemic?
I think it's the opportunity is good right now, considering the case numbers are falling and we're going into a different phase of the management of the pandemic. We've managed many different waves now. Now we're in a different stage where the goal will be different. And so it's good to get fresh eyes. It's good to get a new set of experiences into the position. So I think it's a great idea.
And let's play on that, Raywat, too. The idea of fresh eyes, new experiences. He's gotten a lot of kudos, Dr. Moore has, for what he's done in Kingston. What are your thoughts? I mean, you're out sort of Eastern Ontario, of course.
Yeah, so what are our failings in Ontario? We have a few. One of them has been a kind of clumsy communication. That's where Dr. Moore really shines. He's a fantastic science communicator. He's going to bring some really good public engagement to this role. I'm quite excited.
Anyone a Leafs fan here?
No hands up. Okay, well, that's interesting. That plays into a panel we've got coming up a little bit later. Listen, gentlemen, thank you all for being here. Great to talk to you tonight, and we certainly appreciate your insights, as we always do here on CP24 tonight. Thank you.
Thanks a lot.
Thank you.
Thank you.